Welcome to the Brilliant Board Review Podcast, your trusted source for high-yield board prep, CME, and the latest in clinical medicine.
Let's talk about transfusion and aneurysmal subarachnoid hemorrhage. Now, we're talking about acute aneurysmal subarachnoid hemorrhage and anemia. Now, we're talking about two strategies. Could be conservative. Less than equal to 8 is when we're going to transfuse, or less than equal to 10 is when we're going to transfuse. Now, what was the outcome we looked at? And this is the important thing for strokes, was an unfavorable neurological outcome. And we're looking for what? The modified Rankin Score. Remember, here is at 12 months, and if they had a score greater than 4. So remember, it goes from 0 to 6. 0 is perfect, 6 is dead. And why is this so important? Just think about this. What do we worry about in strokes? Is somebody going to be so debilitated that healthcare resources, family resource, patients going to suffer poor outcomes if they can't move and they're stuck. And they're literally stuck in a bed and they have to have someone wipe their ass and flip them every 2 hours. Just think of the amount of resources that takes. Just think about how the quality of life is. And how is the patient going to feel? Extremely depressed, not feeling well, not doing well, having their butt wiped and then flipped every 2 hours. Now, they also use several other scores at 12-month functional independence for secondary outcomes. And this was at 742 patients at 23 centers. And just they had a good mix. of ruptured aneurysm in the anterior circulation was 638. And then patients that had endovascular coiling, so it's endovascular coiling, would be 443, and there was some clipping cases in this. Well, guess what? There was no difference between the groups, so we can go with more of a conservative policy. Why is that important? Because every time you give a blood product, there's a risk for harm. It's somebody else's blood in their body. Now, they do a great job of matching things, but there's things we probably don't understand. Maybe there's a cytokine response that we really don't fully understand when we're getting somebody else's blood. Hey, maybe it's not always there. It could be certain types of people, certain types of blood. So we want to limit the amount of a foreign object that we place in somebody's body, just like we want to limit the amount of catheters and catheter days that patient has. We want to limit the amount of things that we put in people's body because we can cause harm.
Thanks for listening. Visit brilliantcourses.com to learn more and claim credits for this educational activity. See you next time.